And then Paul, let's break down this first morning bit more into specific topics we're talking about.
Yeah, so in our first part 1 session here, we'll be talking about everything 2D, from acquiring images from Denti or other third party. We'll take a look from start to finish from the 2D capture window and all the different 2D options. Some you may or may not take: panel, bite wing, TMJ, sinus, and Ceph. As an example, we'll talk about the appliances and the entire technique, and then we'll move into troubleshooting image quality on the 2D there. From there, we'll jump into 3D, and we'll just talk about the differences. We'll talk about the capture and Denti navigation to the 3D capture window, into the positioning technique. And we'll also touch on dual scan protocol and denture and PVS scan protocol, which we get a lot of questions on. And then again, to follow up that, we'll talk about image quality and troubleshooting on that 3D end.
Right, so that's going to be basically the total of our morning session here that we're going to be having.
Right.
All right. So let's jump into our session today. This is meant to give everybody an overview of the Vatech product. We know that there are a lot of imaging softwares out there that we can use. Paul and I are going to be working from the Vatech software, the EasyDent imaging software. This is primarily what we're going to be demoing from, but we do realize that we're going to be going to the capture screen. There are a lot of 2D imaging softwares out there. Here are a few that we either have direct integration with or we can swain into. Some of them are including, the Apteryx Imaging Suite, Caddy, Open Dental, Curve Dental for the cloud users. We also work into EagleSoft, Texas, and CareStream, to name a few. So just be aware that really what we're going to be going from here is from the Vatech software into the capture window a lot of times, which you can access through any of these popular imaging softwares there. So I think, Paul, let's start with taking images. We have a lot to cover here, but I would like to first go from our EasyDent and how do we get to our capture screen, and what are some of the choices that we have to capture in our software specifically. So what I'm going to do here is I'm going to go to my EasyDent software, and we have our patient tab here, and let's start with our 2D pan imaging and the options we have for capturing.
Okay, so
from our Denti, I'll let you take it from here. We can go into our capture here.
Yeah, so again, depending on how you're integrating into EasyDent, we have our patient options to add or modify patient right up on top. So the little guy with the plus sign is to add a patient there. We can search for a patient in the search box to our upper left. You don't have to type the whole name, just type your name and you can hit enter or the search button there. To search, one question I get is how do I pull a list of everybody I've taken like a CT on, as an example. The best way to do that is to click that little plus sign next to the search box, and then you can break it down by modality. So if I want to pull a list of all my CTs, just on the first column select CT, and then in the right column I could do a date range. So all would give me all, and then hit search, and that'll pull all the CTs, for example. And that is a common question I get there. But as far as adding a patient in, it's really simple. We just click that right there to add patient. We can add the demographic information in as needed there, and then just simply hit add on the bottom to add the patient in.
And Paul, what are the important parts of this, add patient that we definitely need to get added in here?
Right. So I would say the last name, first name, the gender, and the birthday are commonly the most, what we're entering in here.
For sure. Sounds good.
One thing is you can't change the patient number once you've added the chart in, so that's the considerations. Some offices they don't really care about that. Some offices like to keep it consistent with like the chart in Dentrix or another program, let's say, as an example. So keep that in mind. You can't change it once you save the chart.
Right, so the chart number, we do have workarounds there. If you basically create another patient with that chart, and then you could transfer those images into the other patient. So there are workarounds there, but you make a great point of, not being able to change everything else except for that chart number there.
Right. So besides that, we could modify the patient if you need to edit any of that information. It takes you right back to that window, and you can modify it from there. And then hit modify, and now we'll just hit cancel. And then delete is the next option. So if you do have a patient that you accidentally added twice, which can happen, you would want to move the images over and then delete the first patient chart. So if we click delete patient, you can click on that, and it'll ask you for a password. If you do want to put it, the password is 4 zeros, just FYI on that. So the password to delete or transfer anything is going to be 4 zeros in here. And then we can hit cancel there. And then the next icon there is just simply if we want to clear the screen for HIPAA purposes, that icon with the little piece of paper with the little arrow there will clear the screen. So for any HIPAA related purpose, that's what that does. And then we can, to bring the patient back up, we can go back and search, or do recently acquired or recently viewed from there. So from here, we'll pull up our patient, and then simply to get into the acquisition screen, it's really simple. You just click the acquisition tab up on top and then choose your modality. So either CT or Pano or Ceph, most likely there. So we're gonna go into the Pano screen. So we're gonna click Panorama. It's then gonna load the acquisition interface. So, I mean, everybody who's taking Panos with our units is probably familiar with this screen, but there may be certain things in here that you don't know. So that's what I think we kind of want to highlight here. So it has the patient demographic information on the left side if you're integrating directly into our software there, and it will pull the sex on the bottom. So on the bottom there, we can see it shows based on the patient's age. It will choose man, woman, child. So I will say about that, if the child is 12, let's say, and they have an adult-sized head, it will select that child option, but it will shrink the panel down slightly. So if they do have an adult-sized head, I tend to use man or woman just so I don't cut off any of the condyle area on that. We could choose hard, normal, soft down in the bottom. Slight little bit of radiation difference. So as an example, if you have a patient with a large skull, you could set it to the hard setting. It might be a little clearer if they have a larger size skull. There, and then the message in the middle always tells you where we are. So right now it says please select capture mode and then click confirm. So if you're ever lost, it always tells you what's going on there. So on the right side of the screen, if we focus towards the top there under panel option, we can see under Magic Pan, it is normal. Normally you can pick this slice of panel there. Magic Pan is a good algorithm to give you the best option. I found the most success with the Magic Pan option. Jim, do you have any thoughts on that?
Yeah, basically what Magic Pan is doing is when we're taking our pans, we're taking several, I guess, layers or multi-layer of images, and through an algorithm, it's changing those layers to choose the best image to improve on our anteriors and just the overall clarity of the pan. So you do have two options. Most of my offices are defaulting that to Magic Pan up there. Right. That's not set to that.
I agreed. And then under image option, yours might be set to high resolution, but you do have the green option as well. All of these can be defaulted, by the way. So the high resolution is for the highest quality pan. The green is a great option, and that is a 7-second scan instead of about a 13. So it cuts the scan time in half for the pan. So that's good for any patients that have any troubles with stability, maybe children, maybe elderly, somebody with Parkinson's, anything that stability is going to be an issue. Any of those patients, the green's a great option. So you just click that, and it just cuts that scan time right in half. Under that, we have the arch selection. So we have, of course, it's on normal. You can make those adjustments if necessary for narrow or wide, if that applies. And then we can just set that there.
Paul, specifically talking about, the width of the patient's arch, that's setting basically the Vatech, the focal trough, to follow a big square jaw. Kind of think of the extremes for wide, someone with a really big square jaw or a large head, versus someone with a really narrow palate where you want to have that focal trough following like a sharp V versus the normal U-shape arch there. It really will improve the quality of your image there. So that's something we want to be aware of. Yep.
Right. Okay. So under that, under the panel examination, you could select, if you just want to expose on the right side or on the left side, or just the front, you can make those options. Something a little different there, but standard for your standard pan. If we're talking about the bite wings, we're going to want to click orthogonal. So the bite wing, you can see, doesn't light up until you click orthogonal. So the only thing you do different in here to take a 2D bite wing image is you click on orthogonal and then bite wing. Yeah. If you do have our Series 1 green machine, you are going to want to click on, what is it, Jim? I think it says HD up on top first.
Right.
If you have
Correct.
the first Series green, you are going to want to make sure you're on the HD setting, because that's a little bit different. So you're going to want to do HD, orthogonal, and bite wing, but it's the same here. Here we just click orthogonal, bite wing, and then we can simply take a bite wing. So the positioning is the same as the panel, except for a few tweaks, which we'll talk about.
Yeah, we're going to get into that a little bit later. And Paul, we also have the right or left bite wing. And one thing to note here is it always will do one full rotation when we are capturing. Let's say we do a left pan, we still get that full rotation, just the radiation gets shut off for half of the image there.
Right. And then below that, we have our special examination options. For our offices that are strictly doing 2D, might utilize some of these. So we have our TMJ. You can do TMJ open and close. You can do actually 4 images in one, where it exposes when the patient's jaw is open and then they close, and it gets the open and close in 4 images on one film, digital film there. And then we could also do a sinus PA and lateral as well. And then also TMJ closed and open.
Right, so that's our posterior shot. Yep.
Yeah. Right.
And we're going to cover all this patient positioning down here briefly in the next hour or so.
Right.
On how to do that. So Paul, really, a summary is double check your patient, see if you need to do any changes in body type or density. And really, if we use the top down here, we're going to go from magic pan, choose our density, and then once we select our capture mode, I'm having my patient offices hit confirm. You can see over here it says 14.1 seconds. And this is when we bring our patient in and position the patient with our 3 beams on there.
Right.
And then once we have the patient positioned, I'm going to click on ready. We're going to step out of the room. We're going to go ahead and take our image. And then we're going to get our resulting image here. Right now, technically, we're out of the room and holding down the button, and we're getting our image captured there. Once that's done, it's going to get saved back into the Vatech software, and you would see your pan acquired up here on that. On there. So that's kind of the overview of the capture screen. Paul, should we go into more of our our images now, and let's look at actual the patient positioning. One of the things we highlighted was the 2nd scan here with the green. If we do have any patients that have dose radiation concerns, like you mentioned, patient movement or anything like that, that's where I would use that 7 seconds there.
Right. Yeah, that's really helpful.
Right. All right, so let's talk about patient positioning with our pan. I would say here we have a clean image. I have a nice smile here. I can see my sinus floor. I can see the hard palate is above that sinus floor. I can really see my root tips here. And my condyles are straight up and down as a general overview of this pan. Patient positioning is universal. So we do have our 3 positioning beams. And Paul, it says on the top natural head position, and that's usually what we want to make sure that the patients aren't, don't have their head tipped up too high or have their, chin positioned too low to give us that sharp V in our pan. So let's walk through this as far as patient positioning goes, specifically to the Vatech pan here. We have our mid-sagittal beam, and how are you positioning that, Paul? Or what's your dialogue with the patients?
Yeah, so, and I like what you said about patient positioning is universal, because it really is, no matter, I think, any pan machine is pretty much the same. So here we're talking about the mid-sagittal line, and we want to picture I pictured 2 points, one right between the eyes and one between the philtrum, and you want that line right through those 2 points. Because you don't want to go by the, the nose could be off, the midline could be off. So you like to have that. I picture the head as like an egg or an oval, and you just slice that right in half. That's how I vision it.
This will help also with the patient being twisted, where you see, your condyles get cut off on one side or the other. So we're going to kind of show some examples specifically. Next, we have our Frankfurt horizontal beam, and this really helps us get that Frankfurt plane or that chin tip down about 10 degrees. And this is consistently what I have working with offices where we get those pans that are in a frown or malpositioned. Really, this is the key right here, is looking at that occlusion to make sure the occlusion is tipped 10 degrees down. And we do have this Frankfurt horizontal beam as a guide to assist with that.
Right.
And I run that from the top of the tragus or the top of the ear canal to the informal notch to the eye. So if the patient's in the device with their head slightly tipped down, and you do run that from here to here, and I smile, you would see that occlusion tip down about 10 degrees there.
Right. And if it's not right at the tip of the orbit there, they're either too high or too low, and you need to move their head up or down to adjust for that.
Right. And I think after a while, we're going to play a short video that will go through all these steps specifically for patient positioning there. All right. And then, Paul, why don't you talk a little bit about the canine light?
Sure.
And the
so the canine light is on the side of your machine there, the lever, you move it back and forth. You want to position that. So I would do that third, just in that order, mid sagittal, Frankfurt, and then canine. Just position it so it's right on the canine, on the tooth itself. Sometimes the cheeks or the lifts might be in the way, so sometimes you have to move those. But you want to be able to see it right through the center of that canine tooth.
Right. Really important here is making sure a couple things that you can see on the screen. We have the patient biting right in that bite stick groove, and that's going to get them lined up so they're not too far, anterior or posterior.
Right.
So if they are in that bite stick groove with their chin firmly on the chin rest, we should be able to get that canine light lined up right through the center of the canine there for our pans. And some devices, we have the slide bar on the side, or it's going to be just underneath that chin rest where you move it front to back.
Right.
There.
Yep.
All right. So, Paul, you want to run through a summary here?
Yeah, so just to kind of summarize what we just, Jim and I just described. So we have our patient in the machine, they're biting on that chin rest, make sure they're biting in the grooves. And then, first we'll take a look at the mid-sagittal light, again, running through the eyes and the philtrum. We want that line right down the center there, making sure that's okay. So if that's off, most likely we want to grab the head and move it, or tilt it based on the alignment of that. And then we take a look at the Frankfurt line. Just position that, raise and lower that line so it gets probably to the tragus there, and looking through the orbit. If it's off, we need to raise or lower the machine to adjust and move the patient's head for that, so it goes from the tragus to the bottom of the orbit there, ideally. And then we move to the canine light, of course, focus on that, slide it back and forth until you're right through the center of the canine on that light as much as possible.
Right. So here's a patient that's been positioned in the device. A couple of things I like to note is our palms are facing up, which is going to drop the patient's shoulders down. Well, I know you and I always get questions of like, hey, I've got these patients with no necks or really big square shoulders. This allows the patient to be a little more relaxed.
Right.
Other things I note on here is her chin is firmly on the chin rest, and look where her feet are at. They're basically moved forward a little bit, and her feet are shoulder length apart to provide a little more stability when she's standing there. So that's a good thing for it. It also gets the patient's body really close to the device there.
Definitely.
A couple of tips and tricks, Paul, for this Frankfurt horizontal beam.
Yeah, so I think this is really important to it took me a while to kind of get this concept down. So the Frankfurt horizontal light is ideally to have the patient in natural head position, but everybody's anatomy is different. So sometimes when that line is lined up, they're not really, the angle of the occlusion is off. So ideally we don't want a flat occlusion for the pano for a 2D as on the left. We want sort of a 10 degrees, so the back teeth are 10 degree higher. So we want a slight slope there. And so that ideally that's what the Frankfurt line does for you, but it's not, because everybody's anatomy is different. It doesn't always work out that way. So I always like to look at the actual teeth themselves, and I see a nice slope of the back teeth about 10 degrees up to give you that slight smile in the pan. So if if the occlusion is flat, you'll see the pan will be flat. You want a slight smile of the back teeth, so you have that nice angles, a slight angle in the panel.
Right. Other thing where we have patients that get in the device and are not close enough to the device there. So you can see here how we have the patient standing up straight and their spine is straight, or they're slightly forward of center. This is going to eliminate that white shadow that we see in the spinal shadowing. What we find a lot here is where the patient's comes in the machine is, is it like a big angle like this? And we're going to get that spinal shadowing because their spine is at an angle, and we shoot that beam at it, it's going to cause some distortion there.
Yeah, and I think this is also important because we're having the patient take a step forward and position in their body, but really I think that's all that's doing is putting the spine in that upright position. So I like to focus as much as possible on where that spine is at all times.
Right, for sure. Well, we do have a video. I think now is a good time to go through the video that we have for patient positioning.
Okay.
And then while we're playing this video, if anybody has any questions, we'll take a short pause afterwards, and we can do some Q&A on patient positioning here of different types of patients here. So I'm going to go ahead and run my video here, and we will be back here shortly. Up straight and tall for me, and I'm going to get this in line with their chin, so I'm going up or down. And I'm going to look, I get that right below the patient's chin, because this time I'm looking for more of a natural head position, so their head slightly tipped down. So I'm going to look here, I'm going to say we're going to probably go right in there. Hold on to the hand rest here, and I'm going to have you go ahead and walk forward till your feet hit mine. You might feel like you're kind of leaning back a little bit, but that's what I want. This time I want their body not perfectly vertical, but several centimeters forward of center. Let's go ahead and open, hand bite on the bite stick, and smile really big. I can see she's in the bite stick groove. I'm gonna gently push up on the back of the head and push down on the bite stick. That keeps the patient from doing this, where they hunch down. So now I'm looking at the mid-sagittal beam. We're gonna get that pretty close, right between the eyes, right through the philtrum. And then next I'm gonna look at my Frankfurt horizontal beam. I want to put that right to the top of the tragus, and then to the importable notch of the eye. So I can move that right here by this beam, and say right about there. Smile really big. What I might do is tip you down just a little bit more. So now I can see the line on her is going to be right here, right to the importable notch of the eye right here. When she smiles, we can see the occlusion slightly tip down, about a 10-degree angle tip down. That's going to give us the pans with that nice smile on there. Next, I'm going to go ahead and close my temple supports. It does move the patient a little bit, so I always double check my mid-sagittal beam. Then I'm going to step over here and smile again when I'm smiling going on, and I line this right up to the center of our canine. Once I'm ready to capture the image, I'm going to click on my check mark here, or ready on the device. It's going to tell the patient to please close your eyes. I would also ask you to close your lips around the bite stick. Go ahead and swallow and keep the tongue flat to the roof of your mouth. And then we would take our image. Once it's done, it's going to open, and you can take a step and back to get out. Right before I step out of the room, I usually kind of push up on the back of the patient's head and then walk out, and it just reminds them to stand up straight and tall. Otherwise, what they'll do is you'll be outside, and they'll go like this. Right, and now we have a flat occlusion. Our spine's collapsed. We're going to get the white spinal shadowing. So that last little bit of pushing up on the back of the head is definitely going to give us more of that smile. So next, Paul, we've got a series of images that we want to look at. I would say this is kind of the image on the screen here is kind of the desired image we're getting, or pretty close to that. You can see we have a very clear anterior. My condyles are straight up and down. I can see the nice sinus floor right through here. I can actually see my anterior root tips. I would say minimal interproximal overlap through here, and the hard palate is above the sinus floor. And here you can see that nice smile, that 10-degree angle of the mandible here. So we know we always don't get this image here. Here's your, I'm going to call it proper patient positioning to get an anatomically accurate image. What about malpositioning if the patient moves in the image or is not stable in the image here? Paul, pretty obvious what we're seeing here. You'd say probably what, the head tipped up too high?
Yeah, so I think when we're looking at images that, when people send us, offices send us images, we kind of look at a process of what was wrong. So the first thing I always look at is that angle of occlusion, because obviously the anteriors are blurred, but I kind of start with a checklist of what's wrong, because it usually falls in one of my, I guess, my mental checklists. And the first thing I look at is that angle, and you can see it's almost a frowny effect, and that throws the anterior teeth off, which is probably part of the reason why they're blurry. So that's just kind of how my mental process goes. And then I notice the spine's probably out of alignment, and that whole anterior section there is blurred.
Right. So due to the head being tipped up too high, it's collapsing the spine and then causing that blurry anterior there. And this could be a couple things, could be canine, but that's usually, and also here I notice how the condyles are tipped out too, with the head tipped up. If you tip the head down, it's going to bring the condyles straight up and down there.
Right. Yeah. If you see the head was tilted a little bit more, you probably would have cut the condyles right off there.
Right, out of the picture, yeah. What about this one? This is kind of the exact opposite of what we just saw.
Right. So this one, again, the occlusion angle is just a little bit too much there. And then once you start to get the heads, the chin and head is too far down, the more tilted it is, the more you're going to start jumbling the teeth together, and it's going to throw the anteriors out of position again. And there's a lot of overlap because of that.
Right.
Yep. And then right. That canine light is probably off there.
The mandible there too, yeah. So because they're tipped too far down, maybe head lunged out. One thing I'm noticing here is look at the highway bone, how you have a streaking effect here. Probably where the patient may have swallowed. So you do have some distortion there. Now we're not really worried too much about the highway, but that does sometimes translate if they swallow into distortion in the teeth where you get some patient movement on there. So I always have the patient, swallow and keep the tongue flat to the roof of the mouth. What that does is it keeps them from swallowing while we're taking the scan, but also on this image, you can see how we have a nice clear anterior right here. I think what we're going to do is look at this image and see this dark shadow here. Paul, what is that? That's from not having the tongue to the roof of the mouth, or having that air behind the front teeth.
Yeah, the shadowing there from the tongue. So I think offices and clinicians talk about it to the patient differently, which is fine, just whatever works. You want to have the tongue itself to push to the surface of the palate, basically. So I see some clinicians saying, it's kind of like peanut butter stuck to the roof of your mouth, or super glue. Some say take a I know, Jim, don't you tell them to swallow, push that tongue up. So I think people say it differently. Right.
So as long as you have the tongue flat to the roof of the mouth, that's basically the main thing on how to relate that to our patients there. Other things in the image you can see here at the inferior border of the image here. Paul, what is that?
Yeah, so this is a kind of a common one that we get a lot. I think they're like, why is this big triangle in the bottom of my image and it's white? It's because something's blocking the radiation from hitting the image, and it's the vest. So the vest, what happens usually is, depending on what kind of vest you're using, the radiation blockage vest, it slips up on the back of the neck, and the back of the neck, it's round, so it forms like a V, and that's what that is there.
Right, we can see I always say have the vest high in the front and lower open in the back, because we are shooting posterior, anterior when we're taking our images here. So that's where the lead apron ran up too high in the back of the patient there. Here again, the patient tipped up a little too high because we have the condyles flared out.
Yeah. And the vest, that's why the vest usually the vest has a little bit of a dip in it to avoid that.
Right. And then here's where we noted already where they did not have the tongue flat to the roof of the mouth.
Yeah.
On there. Yep. All right. And let's end, I guess, our troubleshooting thing here with this image here. Really kind of ties everything together. We talked about our occlusion there. Tipped up too high.
Yep, up too high a little bit. Too much is going to make those throws the anterior teeth out of alignment. That's probably why those anterior teeth are elongated on the bottom there. Tongue's not up to the roof, causing that shadowing. We have jewelry in the nose, which obviously sometimes can't be avoided, but I'd say earrings are probably a bigger problem than nose rings.
Yeah, earrings would definitely trigger gloss, but here, due to the head tipped up too high, you get that blurry or spinal shadowing a bit. And also look here in our maxillary root tips. I can't see them, I know, partially due to where the tongue was in the roof of the mouth, but it's pushed up and the hard palate's overlapping there. So if you bring the head down, it's going to have the hard palate move up and our anterior root tips move down to get that nice smile to be able to see the image there.
Right. Yeah, I think that tipping that head down would have helped out of everything here, probably the most.
Right. Also here, it looks like the patient may have been twisted a little bit. And this is another thing, Paul, you and I look at is the distance on the left side, condyle to the edge of the pan, right side, see how they're off a little bit, which is going to cause, some magnification on one side or the other, or elongation where the teeth will be stretched out on there too.
Right. For sure.
And then again, consistently the tongue to the roof of the mouth there. So I think following our patient protocol for positioning the 3 beams, mid-sagittal, Frankfurt horizontal, and then finally our canine, and getting their head slightly tipped down is going to give us that nice smile on there.
Right.
Now may be a good time to kind of move into some of our appliances there, Paul. So within your device, always want to make sure everyone has all of these appliances, and we have uses for each of them. The main one you're always, I guess, most of my officers you're going to be using most of the time is your normal chin rest. So you should have your normal chin rest there, and you're going to use that with the bite stick. And one thing to note about the bite stick is we do have that groove in there. I know it's natural for us at the office to say, hey, put your anterior teeth in that bite stick groove, but as far as a patient, we want to explain to them you need to gently close your front teeth and bite into that bite stick groove. The other thing is I want to make sure when they are biting on that, I want to make sure their chin is firm on the chin rest so it's not floating. So a lot of times I'll have the patient bite on that, and I'll gently push on the bite stick to make sure that their chin is flat or flush on the chin rest, really secure there. That's going to keep them from wiggling around and moving on that. All right. We all know we have our patients that have, either class 3 or where they can't bite right into the bite stick. A lot of times what patients will do, or our fully edentulous patients, we do have our edentulous cup. So I really want to make sure everybody notes this. It's the edentulous cup right there, and that's going to fit right to the patient's chin. So Paul's going to take the bite stick out, and he's going to put that edentulous cup in there. And then really what we're going to do is we're going to have our patient put their chin right into the chin rest there and just rest on that, or right up against it. And that's going to keep them from moving too far anterior or posterior. This will also allow us to still properly line up that canine light. Now, if I do have a fully edentulous patient, what we would do is we would have the patient, I always line up, if they have no teeth, line it up right to the corner of the nose or the nasal succulus right here. So right to the corner, that should line pretty close right to the center of the canine, and that's going to get us properly lined up there. So those are the 2 appliances I wanted to point out, the bite stick and the edentulous cup with that normal chin rest. Paul and I are going to be moving into talking about some other specialty shots. We'll talk about our bite wings, TMJ, and sinus next, and that's where that special chin rest is going to come into play. And you can see that that special chin rest is shorter, so it's about 2 centimeters shorter, and we have the option of using the edentulous cup or the TMJ cup or appliance with that. So that's what that's going to be used for, and Paul will demo that here in a minute on that.
Sounds good.
So one of the questions we always get, Paul, for our trainings is, patient positioning for bite wings. It's the same positioning as our pan, with one caveat. We're still going to use our mid-sagittal beam. We're still going to use our Frankfurt horizontal beam. The difference is the canine light. We want to make sure that we have our canine light mesial or just in front of the canine. So that's going to be the difference when we do our bite wings. Real important to do that. It's going to try and open up more of those contacts. You can kind of look back here, see where we have more of our contacts open. Depending on the patient's dentition, we're not going to be able to open up all those contacts. We're going to do the best we can. Basically, in that bite wing view, we're getting that beam more perpendicular to those contacts to try and open those up if we do have patients that have a lot of tauride or are gaggers, we do have that option there. All right. Paul, we just talked about 2D TMJ and how are we going to position for this? So this is an example of our TMJ that we've taken a lateral view, and we do have 4 images here. So the outside are going to be closed, where the patient was gently closing on their back teeth, and the 2 on the inside there are going to be where the patient was open. And one question I get a lot is, how far open should the patient be? So let's talk about positioning here. We're going to go to our capture screen, and you can see this. We still have 2 different beams. We have our mid-sagittal beam, which is still going to line up between the eyes and here through the philtrum.
Right.
But we're going to be using our short chin block and the TMJ appliance. And what that does is that goes right underneath the nose. And I always say it goes underneath the nose just like a mustache. So once they have that on there, have them lined up, head slightly tipped down. And then we're going to line up our Frankfurt horizontal beam. And Paul, if you can, let's go ahead and demo that appliance there. If you can get the short chin rest and the TMJ appliance.
Right here.
Yeah, so go put that in. You'll see how it does stop. And then Paul's going to go ahead and put that right to the base of his nose. Patient would still be in the machine, and note where his chin is. He's not resting on the chin rest. So he's going to articulate open past that. So go ahead and open. And I say you want to open as wide as you can, but comfortable. You're going to hold that. The scan is about 7 seconds, and then we would take our open. After that, I'm going to have the patient just go ahead and relax. And if I do my closed, I'm going to have the patient go ahead and gently close on your back teeth, and we're going to take our closed there. So those are going to be our 2 options for our TMJ capture. Paul, thank you for using that for a demo there. Here is the result. We talked about our open on the inside and closed on the outside. It is 4 separate images. Gives you a chance to look at the condylar head, the shape of the condylar head, the relationship of the condyle to the fossa there. And we do have a full suite of videos on our website that go through specifically this 2D TMJ capture.
Right. Yep.
Another scan that we do take sometimes is our sinus scan. And what we're doing is here, you can see is we're cutting off most of the mandible here, but we're projecting into the sinus. And here we can see we have our septum, we have our orbits here, we even have our sinus superior up there, and we can see sinus floor and everything through here. So how do we position for that? We do have our short chin rest, and we're going to use our short edentulous cup.
Yep.
And this time we're still going to line the patient up center, but we're going to have the patient's head tipped up a little bit higher. So we're going to have them put their chin on the chin cup, and this time we're going to run the Frankfurt horizontal beam from the top of the ear to the tip of the nose. If you'll notice Paul's in there, he's tipping his head up just a little bit because we're going to be projecting into the sinus there. But that's going to be the imaging and positioning for that. All right. Thanks, Paul.
Sure.
All right. We do have our panoramic positioning guides, and this 1-page sheet can be found on our website, which we're going to highlight at the end of the morning session here. But Paul, let's go through these bullet points really quick.
Yeah, so I just kind of review, starting with moving that machine up and down about like a 1/2 inch under the chin, have the patient stand tall. You can either move it on the front of your machine or use your corded lever there. Again, focus on when the patient comes and bites on the bite stick, have them take the step forward, focus on the spine position, make sure that's upright as much as possible, have them take the step forward, feet shoulder width apart there. They're biting on the bite stick. And then have the chest close to that the edge of that platform there, and then focus on the lights, mid-sagittal light, Frankfurt horizontal, and then again the canine. So usually errors with panels fall into one of these kind of checklist items on what may not have been right.
Right. And then here's a quick guide that's also available on our website. It really goes through how we talk to the patients, or for the staff, the top part. First thing we do is we have the palms facing up, which drops the shoulders.
Right.
Feet shoulder length apart and aligned with the back, heels with the back of the column, and then chin on the chin rest in the bite stick groove. I have them swallow, keep the tongue flat to the roof of the mouth, breathe their nose, and then close their eyes. Why I have them close their eyes is because a lot of times they'll follow that tube head around, and then you do get some patient movement there. Is usually what happens on that.
Mm-hmm. Yep.
All right. Well, I know we do have some clients that have signed on today, and I think we should cover our SEF options here today.
Yeah.
With our device. So our Dent-Eye SEF capture here, I think we can run from here with what we're talking about. We do have our capture screen. The same thing over here. We have our patient's information, man, woman, child, and body type. On the upper right, you do have high resolution in green. That's going to be the time it goes around the head. You do have your lateral SEF, and you can see here, our lateral, it cuts off just behind the ear. And then our full lateral would capture the entire skull. Other options, you have your PA SEF, your posterior anterior, your submental vertex where the patient's head's tipped up, and then your carpus view where you're going to be capturing the hand on that. So with SEF positioning, we do have the patient usually standing. You can't have them sit. We do have 3 points of contact. We have our Nasion bar. Really important to make sure that Nasion bar comes right here between the eyes, and then you want to push it back so it's firmly up against the head. We have our ear supports that we want to have right in the ear canals, and we want to have them tight so the patient can tip and twist around. So that's going to be really important. Similar to the pan, we have our natural head position here. So we do want to make sure the patient's head is slightly tipped down. However, I do not have any beams on there, so we do look from a side view or a lateral view, have the patient smile and look at their head slightly tipped down, ensuring that the patient is standing up straight and those ear supports are tight. So here's our malpositioning. Patients in the machine with their neck hunched forward, tipped up too high. Look at that Nasion bar, Paul. Looks like it's almost on the bridge of the nose here.
Yeah, this is definitely an example of what not to do.
Malpositioning, you can see the angle here. Also look at the mandible here. You can see the left side and right side. Those should almost be aligned properly if we do have the ear supports tight there.
Right.
So here's really what we're looking for more in a properly positioned SEF. Gently closing on the back, standing up. You can see that spine is straight up and down. Nasion bar is proper. And then patient's lined up proper there.
Yep.
Great. All right, Paul, one question we've been getting, actually, I've looked over at the Q&A, and is what do we use to clean the device with? Bite sticks, covers. We want to use a hydrogen peroxide wipe. So Optum or a Clorox hydrogen peroxide. Don't want to spray it on there because then you get a lot of the solution into the device. Just use the wipes, wipe it down, let it sit, and then that will is what we are recommending for cleaning our devices there.
Yeah, so no alcohol is recommended.
Right. Yeah, no alcohol, no Cava wipes. Those are things we do not want to use there. All right, so Paul, let's move into our introduction to 3D capture, capturing a CT. And Paul, I know a lot of times what we get are questions from staff of, or really offices of what am I capturing and why? We'd like to explore that, taking the fear out of capturing of, this is a lot easier in our minds and some feedback from our staffs of capturing CT. So let's kind of delve into that right now. I guess, first of all, we're going to be talking about FOV or field of view. And Paul, how are you explaining that, I guess, just that, the field of view?
Well, I mean, it's, by definition, it's the height by the diameter by the height of it. But I think you just have to look at it differently because we're so used to seeing that, that 2D, just literally a film, even old school film. This we're capturing, you're like kind of coring out like an apple. You're coring out a section of a head. So it's really think of the diameter as a circle, like a paint can, or a coffee can, that shape, and then the diameter of that by the height. Really is what it is.
Right, so we're capturing a cylinder of data, a certain diameter and a certain height. In this case, we have our 17 by 15, so 17 centimeters round by 15 centimeters tall. So we're going to look at some of the available fields of view or FOVs on our devices. And Paul, right now our current offerings are we have the green CT2 and then we have the green 17 by 15. So let's start with our green CT2 offering and take us through some of the fields of view on our two green CT2 devices.
Yeah, so the smallest field of view is on both devices is the 5x5. It's, you know, kind of like a Dixie cup size. That's, you know, usually good for one implant on there. Sorry, one tooth on there, even though you're going to get more than one. I like to think of it as one tooth. The 8x9 is approximately the size of like a coffee cup, so it's 8 centimeters diameter, 9 centimeters high. So that will give you either all of the right or left side, or you can go for the center. You might cut off the third molars on that. But if you want full dual arch, you have the 12x9 or the 13x10. That'll give you both arches there. And then sinus and TMJ, we have, you know, that includes that. So you'll get 16x9. So that's approximately the size of like an average paint can. So you'll get all the teeth, all this, you know, all the sinus, TMJ with the 18x10 with that as well.
Right. So essentially 16 9x9, 18x10, airway and joints, inferior border of the chin and sinus. Moving down to the dual arch, we're going to get third molars forward, same height, and then 8x9 where we can focus on areas, and then same with 5x5 for single tooth capture. So I do have a lot of green CT users, and we just finished our series on dental sleep medicine and airway, and really highlighted the use of the larger 17x15 device or a larger field of view to capture that inferior border of the chin, our paranasal sinus, back to our joints and our airway. Paul, some of these fields of view are very similar to what we have on the G2, but let's look at, you know, kind of the highlight of that larger field of view is the main thing on this device.
Yeah, the 17x15 is great. It's a great size to encompass everything. And then you'll have all the other options of the smaller ones too, if you want to focus in on a certain area, which is nice. So again, you have the 5x5, the one tooth option. The 8x5 is really good for quadrants. So it's same height as the 5x5, just longer, perfect for a quadrant size. You have the 8x8 there, again, coffee cup size for both arches, minus the thirds or one side or the other. And then the dual arch with the 12x9 will give you all the teeth there, or the 17x15 that will encompasses TMJ, sinus, airway, everything there.
Right. So let's talk about capturing with this. You know, we're going to launch from our EasyDent Eye imaging, and we're going to launch into our Vatech software just like we did before. So let me do this. I'm going to go ahead and pause my screen here, and I'm going to get over so we can go through a live capture. Paul, we should be back on our EasyDent Eye software here. We went through this morning, we went through adding patients and all this. So let's go up to acquisition. And Paul, you want to take us through acquisition for CT?
Yeah, so similar to 2D, we're going to add the patient in, have our chart there, click on acquisition, and we're just going to click on CT. It's really simple. It's going to take us into a similar acquisition screen. All the options on the left and bottom are exactly the same as the 2D. So we have the names, the sex, and the density there on the bottom. The only difference here is we're selecting the size on the right. So we get our patient in there. I'm sorry, we select the size first and hit confirm, then get our patient. So back up a second, sorry about that. So field of view, we're picking the size, so it's really easy. So it'll default to the largest size. So we have 18x10 by default, 13x10 for your dual arch there. And you kind of get a preview in the middle of what you're capturing, kind of a little screenshot preview. And then 8x9 there is where you can actually set right or left if you did want to do right or left or center there, if that applies.
Paul, you pointed this out on the right, center, and left. On center, you talked about capturing generally second molars forward depending on patient facial features. I do have a lot of options. Well, I just want to capture right side or left side. So if I do right, it'll get midline over to the right side, and that usually will capture your thirds. If you want to do smaller, maybe a recall scan where we've taken our 18x10, we've done some bone grafting, and we need to just take a follow-up. 8x9, the patient comes in 3 to 6 months later. We want to look at that quality bone through the Vatech software. We can do just that right there.
Right.
So,
yep.
All right.
And then 5x5 there. It's really easy. You just click mandible or maxilla, you're focusing in on the specific tooth that you want there. So we click upper or lower, and then under tooth option, you pick the area. So right incisor left, right molar, left molar. So whatever tooth you're going for there, you just simply click the area of that it falls in and select it. It's really, really simple.
Right. And then we do have high resolution in green on here, Paul, but this is not changing the time. This is actually changing our KB and our MA, so our dose over here. So high resolution and green, it does cut that dose down a little bit. Paul, let's talk about the scan times on our CT. So this is one highlight of the Vatech device, and we're going to be talking more about this in a little bit here, is more about patient movement and the need to make sure the patient holds still. So what are the scan times here, Paul, for a larger fields of view?
So the two large 18 by 10 and 13 by 10, we at 10 seconds for those.
Yeah, we're at about a 9 second scan on those, and then the 8 by 9 and 5 by 5, we're at about 4.9. We'll say 4.9 seconds there.
Yeah.
So really fast scan reduces that chance for patients to move.
Right.
On there. And then last, we have our voxel size. Note that our larger fields of view have a standard voxel of 0.2 millimeters. And then our smallest 5 by 5, our voxel size goes down to 0.08 millimeters. So a lot of offices are using this 5 by 5 specifically for endo, looking at smaller areas, more details through there.
Right.
Yeah. After that, I would hit confirm. We would position our patient, and then we would go ahead and take our image there once we get ready. Through that. All right. Also, we look at patient positioning specifically for our CT now?
Yeah, let's look at the different options there.
Sounds good. Let me get over here. One highlight here, the 4.9 second scan, for 5 second scan here for the 8 by 9 and 5 by 5. So patient positioning, Paul. Still have our mid-sagittal beam right. We want to line that up right through the center of the eyes and through the philtrum here. What about, we do have a horizontal beam, and what are we looking for when we do position our horizontal or our axial light?
Well, depending if you have our earlier green version or a green 2, that axial light, on the earlier version, you can raise and lower that. For the green 2, you can't move that line, so we're just kind of visualizing a flat plane, I think, for that line in that device.
Right. So here on our axial slice, we've chosen our 16 by 9, 12 by 9, or 13 by 10, some field of view there. That line is fixed, as Paul said, so I use that when the patient smiles to make sure they have a flat occlusion. If the patient has a taller facial feature, it might be a little higher or lower. This comes more into play when we have our 5 by 5. If we're doing a maxillary arch, a lot of that times that line will be up above the lip. As for a reference, I would still have the patient smile, align their occlusion parallel with that line, so we know that their occlusion is flat or parallel to the floor. And then same with the mandible. That line usually will be just below the lip, and we want to have them smile and align that mandible to be flat or parallel with the floor there. Right. Let's do a quick review of patient positioning. It's a lot simpler. You notice we took less time talking about our CT capture than we have our pan capture. Paul, you want to run through this with us?
Yeah, absolutely. Just to kind of recap, again, so we're focused in on that mid-sagittal line once the patient's in there. Again, just like the pan, biting on the bite stick, I like to double check that. We want that mid-sagittal line right down the center of the face, tilt the head if that is off. We want it right through the 2 points, the eyes and the philtrum. And then when we look at our horizontal light, if you have your G1 machine, you may raise and lower that as necessary. If you have our G2 device, that's fixed. And so we like to just look at that for a flat plane reference and, have the patient smile, and you want that the occlusion as flat as possible. And to adjust that, raise and lower the machine so we get that nice upper arch parallel with the floor position.
Right. Definitely. Paul, is now a good time to go through a video for 3D positioning? I think that's our next step.
Yep.
So let's go through a live positioning here. In this video, we are positioning on the G2 device, specifically the Vatech Smart, but this would be also applicable to the Vatech G2 16 by 9 or 18 by 10. So let's go ahead and go through our positioning here on this.
identify where the hands need to be, where the feet need to be, and where the mouth needs to be in that order. So patient, come on forward if you would please, and put your hands on the very bottom of the bar here, palms facing up towards the ceiling here. And as far as your feet are concerned, I like to have them align with the right hand side of the column over here, and slide your feet forward just a little bit till they hit my feet right there if you would. Great. And also just make sure your feet are shoulder width apart to also create greater stability for us as well. Terrific. Okay, hands are firm on the bar there, upper part of the body nice and close to the device here. So as I come around to the front of the patient here again, I'm going to pick up the bite stick here just a little bit here, and come on forward and put your chin on the chin rest, bite down on the bite stick, and also kind of pull down on the bite stick here too, to make sure the chin is firm on the chin rest there. Okay. At this point, go ahead and close your lips like you're sucking on a straw there for a moment. Great. So here are lights I want to make sure that we identify that are different than 2D. Okay. However, here's one light that is going to be the same for every single image we capture, which is this mid-sagittal light. See how it's going through the middle of the patient's face, in between the eyebrow and the philtrum there. If it's off by a little bit, touch the patient's face and slide it off here, in this case here, a little bit to his left, and line it up properly there. So I'm going through the middle of the patient's face just like that. Okay. The greatest confusion I run into is this horizontal light here. This light here is a reference to verify we're doing a dual arch scan. So in case doing either a 18 by 10 or 16 by 9 or 12 by 9 and so forth, as part of a dual arch scan, this light here is a reference to identify the fact that we're doing a dual arch. Notice how in this case here, near the corner of the commissure of his lip itself. And if you would, go ahead and smile for just for a moment and see how light's pretty much going right where the bite stick is there as well. It helps us verify that we are capturing a dual arch scan itself. Once the lights are projecting properly here, I can reach there in front of the control panel here again on the LCD screen. And what I want to do then is put the device into capture mode here. So the first thing I'm going to do then is close the temporal rods. And then to get into capture mode itself, there are 3 ways I can get into the ready mode. I can either click on the green check mark here, press once on the white check mark there, or on the capture computer itself. Press once on the button there.
Is moving into capturing position.
And
please wait.
As a side note, it's probably a good idea to stand here with the patient during this process, because that we can then explain to the patient that it's just simply rotating around to get into capture mode.
The system is ready to capture an image. Please close your eyes until image capturing is complete.
So just prior to image capture, we're going to then provide the following instructions for a patient, specifically for our 3D. Go ahead and swallow. For 3D, the tongue can stay flat in the patient's mouth. Only for 2D, it needs to be at the roof of the mouth. Tongue stays flat. Breathe slowly through your nose. Close your eyes and stay still. And that's it. Now ready to capture image itself.
All right, so we went through our video of patient positioning there. And what that will do is it will produce our proper positioning for our patients here. So you can see on screen we have I think that's an 18 by 10 scan, where we are capturing inferior border of the chin, into the orbits, and our condyle. Look what happens if the patient's head is tipped too far down. We're cutting off part of the anatomy here that we really want to see, and this will also have some issues at a later time when we're using our software of trying to navigate through and get the best image there on that. So, all right. Paul, let's go through some of our appliances specifically to the CT device. And we still are having, I get this question a lot, what do we use for patient positioning on CT? And I always say this is really up to the office or the clinical need. So most of the time you're going to be using your tall chin rests. You have, the questions are, do we want the patient with their arches open a little bit, thus biting on the bite stick to separate the occlusion, or do we want them gently closing on their back teeth? We're going to use our chin cup. So let's go through with the bite stick, just like we did before. Paul had the patient bite on the bite stick, gently push on the chin to make sure or the bite stick to make sure the chin is flat on the chin rest. That's going to give us our maximum height. If his chin is off the chin rest, we're going to get some patient movement, and we're also going to be losing part of our superior border there. If the patient does need to be in a centric or natural occlusion, we're going to take the bite stick out. We're going to use our edentulous chin cup. And that's going to be real important to make sure we're doing that. So go ahead and put that in there and just put their chin up against there. You can have them just gently close on their back teeth. I have offices using this specifically if we are capturing our airway, and we're going to kind of go into that next on there. So those are our appliances we're going to use. You do have the option of the short chin rest. So Paul, let's hold that up against the two chin rests next to each other. And I do have offices saying I need to capture into the ostium for implants, or I want to make sure I'm getting my joints. Note that shorter chin rest is 2 centimeters shorter. Thus, we're going to lower the patient down, cutting off the inferior border of the chin, but we are going to transfer that further superior to capture further superior in the image itself on there. So that's the other option. And with that short chin rest, you always have to use that chin cup itself through there. Perfect. All right, Paul. 3D capture. You know, you and I take a lot of questions on airway capture. Here is our chin cup with our chin rest. And this next slide here is going to show us where we do have the patient in that chin cup, gently closing on their back teeth, where we have highlighted the airway through there. That's going to be the benefit there.
Right.
All right. Using that chin cup there. All right, I guess we should move on to the third option with our CT device, specifically the green CT, is we can capture a cast or stone model. So one thing to note here, this model scan capture is just for scanning cast or stone models. So we're going to come here. We do have this model jig. You take out the chin rest and you put this appliance there with this clear plastic on top. You would place your model on the platform, and then you would line that up center. To get to that, we're going to go to our acquisition. And Paul, you want to run through this again?
Yeah, so we get our patient up just like before. We click on our acquisition tab, excuse me, and then we go in, we're going to go ahead and select a model in the acquisition. So you can switch modalities, but if you have to, if you accidentally click CT or panel, by the way, you can click on the double arrow and switch modalities if you need. So we're going to click on that, and we're going to select model. So we're going to click model, and it will take you right into that acquisition screen there, right in there, kind of in the divided sky there. And then we're going to select upper or lower from there. It's really simple. Just select upper or lower, and we can scan it just like we would a patient.
Right. And Paul, I believe we do have a short video here that's going to play specifically for our model scan.
Yep.
And this is going to take us through acquisition, CT capture, going over to the double arrows.
Yep. Selecting model.
And this is where we're placing that model on the appliance there, lining it up center. Do want to make sure it's on there. We have an 8x9 field of view to capture. Click on ready, and then from there we're going to go ahead and capture our model.
Right.
Once that's done, it's going to show up here as your STL file within the software itself.
Yeah.
All right.
And one question I get, the teeth are always facing up, so if it's the flat model side down always.
Right. So here's our EasyDentEye patient tab. Once we've taken that, they are going to show up as impressions or STL files through there. Let's talk more about, I guess, dual scan protocol would be next. We get a lot of questions on this. Right. And this is where we're going to be going through and capturing a denture. We're going to be placing our radiopaque markers. Usually we're going to do 3 buccal and 3 on the lingual side or the palatal side. Once we have our markers placed, we are going to use our denture scan protocol here with the scan jig. Place our denture on top there, and then this time we're going to choose our 13x10 or our 16x9 field of view. This is for a denture or a PDS scan. 13x10. Change our KV and our MA to 90 and 9 MA.
Yeah.
And then we're going to go ahead and go through our capture right here.
So we would always scan it just like you scan a regular patient in there.
Then you can see we're placing the denture on that platform, and then we're going to go ahead and go through our capture on there. And that's going to go ahead and reconstruct that. Once it's finished, it's going to reconstruct it as a DICOM this time, and this is where we would probably go ahead and export this as an STL this time. All right. So let's move forward here. Once we've captured that, we talked about it adding as a DICOM right there, and this is where we can go to dual scan. Next, we would scan the patient wearing the denture,
right?
And we would go through and scan our patient there. Once we have that, a couple things I do is I open my Easy 3DI. I do change my settings to my soft tissue under our virtual rendering, and you can see our denture right there. We would go up to our main menu. We would go over to Export Surface Model, and then we get our pop-up screen here, and then we're going to go ahead and click on our slide bar here and hit OK and export that as an STL file.
Yep.
If you have any other questions about that, please feel free to reach out to the education team or email us if you want to have this as a specific topic for a dedicated webinar in the future. All right, Paul, a good time to review our patient positioning overall as far as CT?
Absolutely. So just real quick with the CT to recap, we're going to raise and lower our height adjustment there on the front of the machine or with our trigger button. Proper focus on proper vertical position. Again, upright, spine upright as much as possible. 1 inch forward to vertical, and then red lights, laser lights, super easy here. So mid-sagittal light through the center of the head there, through the eyes and the filter, and then our axial guide light to either move as necessary depending on your machine, or just visualize that flat plane with if you have our G2 device, and then angle accordingly if the occlusion is not at a flat plane, making sure the patient's as still as possible. Tongue doesn't matter with the 3D, the position of the tongue, just stability is the most important, and go ahead and hit your trigger button.
Right. And here's kind of some talking points that you covered. Palms facing up, make
Right.
sure they're standing straight, teeth in the groove or gently closing on their back teeth. Swallow and just rest your tongue, close your eyes so you don't follow the machine, and then we can go ahead and take our image there.
Right.
Paul, do we have any questions coming in?
Yes, there was always questions. Let's see. Can you explain again the denture, the KV, or the settings for the denture and PVS scan? I think the KVP MA.
Yes. So KVP and MA on a denture scan, we want to make sure that we're changing this to our KVP of 90 and our MA of 9. We worked with 3D Diagnostics on this, and they've tested several machines to get the best optimal resolution for dentures or PVS scans, and this is what they're recommending specifically when we are capturing there. So let's talk about image. Paul and I have been really talking about this patient positioning and image quality and making sure that everyone does not move and they have a flat occlusion. What happens if they do move? I get questions all the time of, well, the patient moved, can I use this image? This is the example of someone actually took a picture and texted this to me. And yes, there's some pretty massive patient movement here. And I can see this by this double line here.
Right.
You can see all these double lines of hyoid bone. You can see an extra line here. So, Paul, what are you seeing in this image here?
I'm seeing some ghosting in here, definitely those anterior teeth. You know, the position of the soft tissue, they're kind of like a fluff head where You can see a doubling or a ghosting there as well in that soft tissue there, mainly.
Right. So yeah, so can't stress enough to make sure that the patient does not move. Here's some other options. You know, we get, let's say we want to use this for endo. Here's either an 8x5 scan or maybe a 8x9 scan where we're trying to look at these canals. This is, you can see the streaking effect off of here. That's really going to show us some patient movement. Look at our next scan here, where we do have the patient nice and still. I can see the PDL around the teeth. We can see actually that missed canal and the issue there and the furcation through there.
Right.
Paul, here's another one, and you talk a lot about this. Look at this axial slice, how we do have this streaking effect across the mandible here. What about the 3D rendering over there? What do you see, or this is another easy way to tell if we have patient movement?
Yeah, if you look at that 3D on top, you can see there's like, it's hilly and bumpy. You know, that's from movement. It's almost like you took a rag and wiped it. It kind of causes that like first tube effect where it's mushy and hilly. So the bottom image is much clearer. You can see that, you can see the definition of those teeth, the gums there, and the dentition there very well.
Right. So making sure that that patient does not move at all on there, just very still, and the flat occlusion also.
Right, right.
All right. Well, now let's get to some questions on here.
Yes, okay. Let's see. What if Jane is asking, what if I select the wrong field of view in the acquisition screen? How do I go back?
Gotcha. So
we have what you would have there. Yeah, how do we go back?
Perfect. Well, let's do this. Let me show my screen here. And once I've clicked on the confirm button, now I'm locked in whichever field of view or whichever image that I want. To go back, I do have to click on the X in the upper right. This allows me to go back to my screen, my acquisition screen, say now we want to take our CT, and we can go ahead and go through that again.
Right. Okay.
All right.
What brand of markers are you placing on that denture example that you displayed?
Gotcha. So the dentures we worked with, that's going to be a SureMark, is what they're called, SureMark markers, specifically to what we had reviewed there. And you get some more information, questions on that from us.
Okay, here's one more question, Jim. Taking, what if the patient moves during the scan? So, you know, I guess we get this question a lot. Hey, should we retake the scan? So what are your thoughts on that question?
Really what we want to do there is we do want to make sure, I would check with the doctor, honestly, say, you know, should we retake this or not? That's really going to be up to your office on, do we need to take this scan again or not? So yeah, that's really looking at that axial slice, see if there is movement. If we can use it, yes, we can go ahead and take it again, or we don't have to take it in, but if there's too much movement, it's not going to be clinically useful for us.
Right.
I just want everybody to be aware of, if you go to Vatech here and if you click on service and support, we do have our customer learning center. And over here at 3D imaging and 2D imaging, this is where we have all of our user videos. So it's going to ask you to create a new account, or if you already have one, you can click log in. And do check out some of these videos. It goes over, you know, your evaluation of calibration of the device, pan positioning, CT positioning, your stone model, and then all the documents we talked about are going to be down here. Some other questions we get are troubleshooting questions. You know, how do I export a scan, or how do I save a file on a disk? I do have my FAQ here, and this is, you know, commonly asked questions. You know, I want to know how to positioning, and it's going to bring up different views. So panoramic positioning troubleshooting here, or can I upgrade my software? Things like that are all going to be through this FAQ device here. And then one new thing we just actually implemented within the last month is this live chat. So right here, I can chat with us. So full name, where you're located, and then you're going to get linked directly to one of our tech support specialists. They can log in if we do have some issues on a troubleshooting guide. We can go right to this, and they can guide you through quickly and efficiently going through our positioning or our troubleshooting guide there. So keep that in mind. This is something that has been implemented. It really speeds up the tech support time of going through that.
So thank you for joining us today for our imaging workflow webinar here. Any questions that we did not get to, or if you have any additional questions, please reach out to us at education@Vatech America, and we'll get back to you promptly with any questions